Hey everybody, this is Professor Turpin. I'm just gonna finish out reiterate a couple slides and then finish out the last few slides from our endocrine lecture. Just to reiterate, make sure that you really know the 5 S's. I won't read them again to you, but that's a good way to kind of really remember the interventions for Addison's, and they really address maybe the main key problems that patients have in terms of, hyponatremia, hypoglycemia, and then, potential for hypertension and watching for their physiological functioning in terms of physical stability, and again, trying to really identify the cause. As we mentioned before, these patients really have to be watched very closely for hypovolemic shock. A lot of the actions for nursing are going to really be strict I&Os, forcing fluids, monitoring fluid balance along with monitoring electrolytes. Vital signs may be every 1 to 4 hours, just to make sure there's no changes in the blood pressures and perfusion because of this low volume status. Watching them for safety reasons, for getting up too fast with orthostatic hypotension. As they are on, have to be placed on corticosteroids for treatment to replace the steroids that they are not producing. They have to be watched for signs of infection, and because of the disease itself, they want to be really, you want to try to protect them from extremes with light, noise, and temperature, because of the way the neurological function may be affected by the disease. Chronic care really is to teach patients to really understand what constitutes a crisis situation so that they then take extra effort to kind of prevent a crisis situation. So, they want to make sure that they take plenty of sodium intake with stress. Be very cautious during hot weather where they may easily become dehydrated. They need to have frequent rest periods during the day. They need to take in large amounts of oral intake and really write down probably every day the things that they're taking in so that they do keep track of that. Some patients will have to be taught to mark off a milk jug full of water or so many liter bottles that they have to have filled and drank so that they know they really have met their goals. And then again, monitoring for orthostatic changes. Chronic patients are also going to be on hydrocortisone, and so I think we mentioned this towards the end of class. You want to give those dosages in a way that mimics the natural release of cortisol in the body that would typically be occurring from the adrenal glands. And most of that is, 2/3 of that is in the morning with 1/3 in the afternoon. And so it makes them feel like they're on a normal pattern that would happen naturally. The medications themselves need to be administered with food, and blood sugars need to be monitored because they can drop low because of being hypoglycemic with the disease, or they can also be high because of the external use of steroids. So keeping track of that is important and teaching them to do that. They also may have their dosage increased during times of stress to prevent a crisis occurring. In addition to the cortisol, they will often need aldosterone replacement, and Florinef is the drug of choice for that. These are some of the situations that typically indicate a need for dose adjustment. Things that are infection potential related or severe pain like fever, influenza, tooth extraction, and then heavy physical exertion Okay, we're going to move on to talk a little bit about Cushing's disease and Cushing's syndrome and the difference. Cushing's disease is when there is a hyperfunctioning of the adrenal glands, whether it be because of adrenal gland problems or secondary based on the hypothalamus or pituitary disease. As we've talked about, upstream can be causing an excess production of ACTH, and then that means that the adrenal glands are overproducing cortisol. As a result, you can just think about how cortisol affects the body. We know that when people are under stress, they produce more cortisol than they need, and that's sort of a defense mechanism of the body. But with this disease, because it's so much of an excess of steroids, they will show increased body fat, and a lot of this is around the truncal area, and we'll see some pictures of that. Also, because of excess steroids, their immune system is diminished because lymphocytes are killed in that environment, and so they will typically be, high risk for infection. And if you think about this, this is the whole thing that you see a lot of times with the diabetic population, high blood sugar, and because of that, high infection rate. And in this case, it's caused by the high dose of steroids that's being released by their adrenal glands. Now, that is really the disease. And so when you're trying to differentiate between disease and syndrome, just think about that there are patients that have a whole slew of other kinds of diagnoses in which they have to use ACTH for their disease, or they have to take glucocorticoids like prednisone ongoing. It's not just a short-term thing like for a little bronchitis or a flare-up of poison ivy, but they really have to take it for the rest of their lives to keep their disease under control. And those are listed at the bottom of this section. And when you see the term exogenous, that means something that doesn't originate from inside the body. So they're taking this as a medication that they're on for these diseases. And so patients that have asthma, COPD, some autoimmune disorders, patients that have had organ transplantation, they often have to have steroids for long periods of time. Cancer patients that are getting chemotherapy will end up being on corticosteroids for long periods of time. And all of those type of usages of these can create a syndrome that makes the patient look very much like the Cushing's disease patient, but it's really just because of the excess steroids that they're externally taking in. Cushing's disease itself really, though, is endogenous, meaning inside the body. The adrenal glands are producing a ton of extra cortisol secretion that is over and beyond what they need. Things that can come from is bilateral adrenal hyperplasia, meaning both of the adrenal glands have tissue that is growth that's abnormal, and it's creating the glands to hypersecrete cortisol. Pituitary adenoma. Remember we talked about how benign tumors of the pituitary can make the pituitary function in excess, and when that happens, it will produce too much ACTH, which then stimulates the adrenal glands to produce too much cortisol. Also, malignancies in certain carcinomas of the lung, GI tract, and the pancreas can also have a similar effect. And then just primary disease of the adrenal glands themselves, if they have benign tumors or cancerous tumors, then they can just be hyperproducing these hormones as well. These are some of the manifestations, and you're going to find that the majority of these are completely opposite of Addison's. So that's why it's important to put those on a grid and keep that separate between these diseases, because it will help you memorize the differences. So either the patient is going to have too much ACTH produced, which is then pushing the adrenals from the pituitary to produce too much cortisol, or the patient's adrenal glands themselves have disease and are creating excess cortisol. And what results from too much steroids is hyperglycemia, hypertension, hypernatremia, which of course is opposite than the Addison's patient. They have redistribution of fat, and we'll see some pictures of this. They have what's called a buffalo hump, a very enlarged trunk in terms of swelling, and fat deposits all around their upper body and chest and abdomen, and not so much, in the legs. It's very kind of obvious. They will develop a very moon face. We'll see some pictures of that. And they also will have thinning of the skin and a very distinct condition, sometimes called purple striae, that looks like purple stretch marks. They have changes in protein metabolism, so in other areas of the body you may see muscle wasting and weakness. In women, they may have hirsutism, and because of the high level of cortisols in their body, that the steroids will kill off lymphocytes, so often you'll have low lymphocyte counts. They also will often experience low calcium and potassium, and the low calcium will also create a situation where they have very low bone density and can lead to osteoporosis. You can see here on the picture at the top left, the patient has the buffalo hump, this big humped over area on the back of where fat is just kind of redistributed on their back. The lady at the bottom has got a very moon roundish face. And then on the right is a picture that really shows a lot of the other issues that come along with Cushing's. This is the purple striae that I was talking about that you may often see with this disease. These are just some of the diagnostic studies that are done. 24-hour urine for free cortisol will kind of let people know if there's something going on there. And if they have high levels, then this indicates that they have Cushing's syndrome. There's some other suppression tests that can be done with dexamethasone to kind of test to see if they're borderline. And then a lot of times imaging scans in terms of CT and MRI of the pituitary and adrenal glands are done, because then you can kind of tell, is it coming from the pituitary or is it coming from some kind of disease on the adrenal glands, so that you're again finding the cause. The main goal here is to normalize hormone secretion. So that depends on the cause in this case. You have to be able to find, is it pituitary issue, where we've talked about the pituitary gland removal surgery, as well as the radiation, the gamma knife treatment that can be done to destroy that area. And then with adrenal tumors, if it's coming from the adrenal glands, then they may go in and actually do an adrenalectomy or removal of the adrenal glands. If Cushing's syndrome develops during the use of corticosteroids for another disease, then they may gradually discontinue therapy. They may decrease the dose somewhat, and occasionally they'll convert to